Okay, we are joined with Kaylee here today. We're doing an awesome lip enhancement. Very excited about this. We'll be using Kiss, and we're going to do the 90-degree AAFE technique. We're going to give her a lot of show without a huge amount of projection, but of course still a decent amount of projection because she is young and her young, youthful face can really handle it. She's a travel nurse and she's probably on her way to California next, so we really want to make sure that she fits in there, so we get to get away with a little bit more than sometimes we see in Ohio. Okay, so we're gonna go in with a 90-degree technique and really give Kaylee a lot of lip show. So I like to start with the peak of the Cupid's bow. She happens to have a little bit lower peak on this side than the other. So by and large, I like to start with the area of greatest deficiency. That way I can build it up and know how much I need. And I am purposefully coming all the way through that vermilion border in this case. You can see just how shallow I am. How are you doing? How's it feeling?
Good.
Awesome. As you can see, she's nice and shiny on the bottom lip, so I'm just keeping that numbing on her. I like to keep my patients as comfortable as I can, so since I happen to know exactly where I'm going and I have a plan for where my filler is going to wind up, I'm able to plan ahead and keep the numbing on as long as I can. Okay, so you can tell if you really assess and check out both sides of the lips, there's a big difference in height. Next thing I want to show you, open up for me, dear, is you can even see that filler through there. So a good injector would be like, okay, that looks good, and leave it, but a great injector will make sure it's always blended in. Okay, so I'm going to go into the other Cupid's bow here. And of course you can see the difference between one and the other. This is probably, in my opinion, your most important injection. You have to keep them symmetrical. You absolutely can go back in if you didn't accomplish what you wanted, but then you start risking more swelling and more bruising. And as an injector, that's always kind of hard to chase. You can hear in our video here probably, Carrie's got that Comfortox vibe going. Is that helping?
Mm-hmm.
But if you hear that vibrating, that's what you're hearing. It's her good little distraction. She puts it right against her chin, and that vibration distracts the brain a little bit from all of this pinchiness. Done with this lip yet, but at the moment I'm going to take that little break. Open up for me to give her a nice roll and massage. And just blending all of the product into her tissue. The worst is having a patient walk around with those lumpy looking lips. We want them to look soft and like they've never been filled before. See how much fullness she's got over here. This was actually midline, and now she's so full on that right side because that's all I've done so far. It almost looks like that first lab is no longer midline because I pushed it over. So that's personally why I like to start there, so you kind of keep track. And I'll come over and do the other side. We're getting there. We're just building some struts and shaping. So we're going to add a little bit more volume. Open and close once. And put your lips back in. Good. All the patients come open and close just so I can make sure that when the lips approximate, they look the way I want them to. And approximate means just coming together. Give her a good clean here. And come into your bottom lip open. I always make sure my proportions are correct too, so that's why I like to stop and really look from the side. I have her smile. Go ahead, smile with teeth. Good. I want to make sure I've got a nice, pretty, really natural roundness to that bottom lip. Looking pretty good. I do want to shape that cupid's bow a little bit more, so I'm going to go into that pinchy area. And then teaching, I always say that darn nose gets in the way, and boy, it does. Kaylee, can we just cut off your nose, please? She says, sure.
As long as you put it back on.
I'm going to sit you all the way up. I just want to keep assessing here. Not that we're done, but... Open it this once. And open and stay open. I like to make sure too that I'm assessing and checking how the lip hangs. Smile with teeth. Making sure there's no balls or anything hanging down there. That looks incredibly unnatural, so we never like to leave our patients like that. I treat my sister, and she will ask me how many more pokes all the time. Open for me. And unfortunately, there's not really an answer to that. So like asking a hairstylist how many foils they're going to put in for highlights. We are done with Miss Kaylee's lips here. Go ahead and kind of go side to side. So you can see her proportions are still even here. That's quite a bit of fill. Don't get scared. It is a good amount of swelling as well. So we always say don't love it or hate it for 2 weeks. The particular product and method we use is very much in the front here. We call that a lot of show. She's got quite a bit of height here. The border itself is going to be a lot of swelling. So I always explain that to my patients that that's the part that's going to calm down. So don't get too weirded out by that. You'll definitely have really pretty lips, but I love the proportions and I think you're gonna love them, especially in a couple of weeks. What do you think?
I love them.
Yay. All right, thanks for watching. We're all done with our lips.